After age 60, persistent itching may indicate a shorter life expectancy. We all know the human body has an amazing way of signaling when something is wrong, but sometimes these signals are easily overlooked. Minor issues, such as mild itching, can indicate a serious health problem. This is especially true as we age. After 60, our bodies don't function as they once did, and seemingly small symptoms can significantly impact longevity and quality of life. This video explores one often missed yet crucial sign: itching in specific areas of the body. Have you noticed any unexplained itching? Let's discover what it might be telling you about your health. 1. Itching in the lower legs. The lower legs and ankles are furthest from the heart, meaning blood must travel a longer distance and overcome greater pressure to reach these areas. When overall blood circulation is less efficient, due to narrowed or weakened blood vessels or blood pressure issues, blood flow to the lower extremities is compromised. This can lead to oxygen and nutrient deprivation in the skin, causing itching or discomfort. Several factors can contribute to itching in the lower legs. Insufficient blood supply to the skin. Reduced blood circulation deprives the skin of essential nutrients and oxygen, potentially leading to dryness, flaking, itching, or a burning sensation. Weak or blocked blood vessels. Narrowed or blocked blood vessels, such as in peripheral artery disease, PAD, impede normal blood flow. This can cause itching and other symptoms like swelling, pain, or a heavy feeling in the legs. Nerve-related itching. Poor circulation can also affect nerves, resulting in itching, numbness, or burning sensations in the extremities. Leg itching may be an early warning sign of peripheral artery disease, AD, a condition where the arteries supplying blood to the legs become narrowed or blocked. PD can increase your risk of serious problems like stroke or heart attack. If left undiagnosed and untreated, P can lead to more severe complications such as arterial blockage, blood clots, or even tissue death. Risk factors for peripheral artery disease include a sedentary lifestyle, which weakens blood circulation, an unhealthy diet, high in cholesterol, salt, and saturated fats, increasing blood lipid levels and plaque formation, smoking, which narrows blood vessels and impairs circulation, and diabetes, which damages both small and large blood vessels, leading to poor circulation, particularly affecting the legs. Important considerations. Persistent itching in the lower legs without a clear cause, especially if it doesn't improve with moisturizers or changes in skincare routine, may indicate poor circulation. To check your circulation, gently press on the skin of your lower leg for a few seconds. If the indentation from your finger doesn't disappear immediately or lingers longer than usual, it could be a sign of circulatory problems. Improving circulation. Regular exercise, such as walking, significantly improves blood flow. A healthy diet. Focus on plenty of fruits and vegetables, reduce saturated fats, and limit processed foods. Hydration. Maintaining adequate hydration supports healthy circulation and can alleviate itchy skin. Medical consultation. If itching persists or is accompanied by pain or swelling, consult a doctor for a circulatory assessment and appropriate treatment. 2. Upper back itch. Dr. Emily Carter has indicated that persistent itching in the upper back, particularly around the shoulder blades, may signal nerve-related issues or spinal damage. This could manifest as notalgia paresthetica, a condition involving compression or damage to spinal nerves, especially in the upper back. A detailed analysis of the causes and associated risks follows. As we age, the intervertebral discs in our spines, particularly in the upper back, can lose moisture and shrink. This can lead to compression or damage of the nerves in this area. Damaged or compressed nerves may send incorrect signals to the brain, causing itching or numbness in the upper back skin without any apparent external cause. Several factors can contribute to upper back itching. Nerve damage or compression. Degenerating and dehydrated spinal discs can put pressure on nearby nerves, resulting in itching or numbness. Spinal degeneration. The degeneration of spinal discs and joints over time can compress nerves, causing itching, pain, or numbness in the upper back. Postural issues and lifestyle habits. Frequently maintaining incorrect posture while sitting or standing can put pressure on the spine and increase the likelihood of nerve damage, leading to itching. Itching on your upper back, especially when unrelated to allergies or dry skin, might indicate notalgia paresthetica. This condition involves nerve damage or compression causing itching or numbness. Left untreated, it could lead to more serious spinal problems, such as reduced mobility, chronic back pain, and even impact posture and quality of life. Risk factors for spinal degeneration include aging. The natural aging process can cause the spinal discs to degenerate, reducing flexibility and shock absorption, and thus placing pressure on nerves. Poor lifestyle habits. Prolonged periods of incorrect posture while sitting, standing, or sleeping can strain the spine and lead to neurological problems. Lack of exercise. Sedentary lifestyles or insufficient exercise can weaken the muscles supporting the spine, increasing the risk of nerve compression. Injury or trauma. Spinal injuries from accidents or impacts can damage the discs or nerves, resulting in pain or discomfort. Important considerations: persistent itching, despite moisturizing. If your upper back itching persists despite using moisturizers and adjusting your skincare routine, the cause may not be dry skin, but rather a neurological issue. Itching with numbness or pain. If itching is accompanied by numbness, pain, or discomfort in your back, it could indicate nerve compression or spinal degeneration. Unrelieved itching with posture changes. Upper back itching that doesn't improve with posture changes or typical pain relief measures may signal a spinal problem. Physical therapy solutions. Physical therapy can help improve posture and reduce pressure on nerves. Stretching and strengthening exercises for the back can alleviate discomfort and prevent spinal problems. Postural adjustments. Maintaining correct posture while sitting, standing, or sleeping helps reduce pressure on the spine and nerves. Regular exercise. Increased physical activity strengthens muscles and supports the spine, reducing the risk of nerve damage. Medical treatment. If upper back discomfort persists or is accompanied by other symptoms such as back pain, limited mobility, or numbness, consult a physician for diagnosis and appropriate treatment, which may include pain medication, anti-inflammatory injections, or surgery if necessary. River 3. Itching in the palm of your hand. Causes of poor liver function. The liver plays a vital role in detoxifying the body and producing bile for fat digestion. When liver function is impaired or the liver is damaged, bile salts can accumulate in the body instead of being eliminated. This accumulation can irritate the skin, particularly the palms and soles of the feet. Fatty liver disease. This is a common cause of itching in the palms. Fatty liver disease can result from unhealthy lifestyles, poor diets, or excessive alcohol consumption. A fatty liver is less efficient at filtering toxins, leading to bile salt buildup and itching. Cirrhosis. Cirrhosis is a late-stage liver disease where liver tissue is replaced by scar tissue, reducing liver function. Itching, including itching of the palms and soles, can be an early sign of cirrhosis. Itching palms aren't always simple and can sometimes indicate serious internal organ problems, particularly liver issues. Here are some warning signs of potential liver problems. Nighttime itching. Liver-related itching often intensifies at night when the body relaxes and is less focused on other issues. This itching doesn't respond to typical moisturizers because the problem isn't dry skin, but rather a buildup of bile salts in the blood. Itching accompanied by other symptoms. If palm itching occurs alongside symptoms like fatigue, unexplained weight loss, or jaundice, yellowing of the skin or eyes, it could signal more serious liver conditions, such as fatty liver disease, hepatitis, or cirrhosis. Recurrent itching. Recurring itching, especially without a clear cause, may indicate a long-term liver problem. This itching might not be limited to the palms, potentially affecting the soles of the feet and other areas. Risk factors. Unhealthy dietary habits, such as consuming diets high in saturated fats, sugars, and processed foods, can increase the risk of fatty liver disease, potentially leading to palmar itching. Excessive alcohol consumption can damage the liver, resulting in cirrhosis and reduced detoxification capabilities, which may manifest as itching. Obesity significantly increases the risk of fatty liver disease, often accompanied by skin itching, including palmar itching. Certain medications can cause adverse reactions, including skin itching. If itching begins after starting a new medication, it may indicate an allergic reaction. Liver function tests. If you experience persistent itching, especially on your palms, that doesn't improve with moisturizers or is accompanied by other symptoms like jaundice or fatigue, consult a doctor for liver function tests. Blood tests can assess liver enzyme levels and overall liver health. Dietary adjustments. For individuals with fatty liver disease or other liver conditions, dietary changes are crucial. Incorporate fiber-rich foods and plenty of fruits and vegetables while limiting high-fat and sugary foods. Increase physical activity. Regular exercise improves liver function and reduces body fat, potentially lowering the risk of fatty liver disease and related complications. Limit alcohol consumption. If you drink alcohol, reducing or eliminating consumption protects your liver from alcohol-related damage. Medication. If a liver problem is confirmed by your doctor, they may prescribe medication to support liver health or treat underlying liver conditions. Tests you can try. Pressing on your palm. A simple test involves firmly pressing a finger into your palm and holding it for a few seconds. If the palm remains red longer than usual or feels tender, it could indicate a liver problem. Checking for other symptoms. In addition to itching, pay attention to other symptoms such as fatigue, changes in skin color, jaundice, unexplained weight loss, or a feeling of heaviness in the abdominal area. 4. Itchy scalp. High blood sugar and insulin resistance can lead to chronic low-level inflammation throughout the body, including the scalp. This inflammation can damage tissues and impair the immune system, resulting in dryness, itching, and irritation. When the body doesn't effectively utilize insulin resistance, blood sugar levels remain elevated. This hyperglycemia weakens the immune system and damages tissues, including the scalp, leading to similar symptoms of itching, dryness, and irritation. Furthermore, chronic inflammation from high blood sugar compromises the scalp's natural protective barrier, increasing susceptibility to irritation and itching. High blood sugar can also disrupt the scalp's oil glands, causing either dryness or excessive oiliness, both contributing to itching. Finally, elevated blood sugar can impair blood circulation, particularly in the small blood vessels of the scalp. This reduced blood flow limits the delivery of essential nutrients and oxygen to scalp cells, resulting in dryness and itching. Itchy scalp can sometimes indicate a serious underlying health condition, such as prediabetes or type 2 diabetes. Here are some signs and risk factors associated with an itchy scalp that warrant attention. Persistent itch. Despite shampoo changes. If your scalp itches persistently without signs of dandruff, seborrheic dermatitis, or fungal infection, and the itching doesn't improve despite trying different shampoos or hair care products, this could signal high blood sugar or insulin resistance. Dry, damaged scalp. An itchy scalp related to blood sugar imbalances may be accompanied by dryness, flaking, or even brittle, easily broken hair. This suggests the scalp isn't receiving sufficient nutrients and oxygen from the bloodstream due to circulatory issues. Blood sugar fluctuations. In addition to an itchy scalp, other signs of blood sugar imbalance include fatigue, excessive thirst, frequent urination, and unexplained weight loss. These symptoms may be associated with prediabetes or type 2 diabetes. Scalp pain or irritation. If itching is accompanied by pain or a mild burning sensation on the scalp, it could indicate inflammation, a manifestation of the effects of diabetes or insulin resistance. Risk factors for prediabetes or type 2 diabetes. Individuals with prediabetes or type 2 diabetes are at increased risk of scalp itching due to changes in the immune system and chronic inflammation. Unhealthy dietary habits. Diets high in refined carbohydrates, sugars, and processed foods can elevate blood glucose levels and contribute to inflammatory issues, including scalp itching. Sedentary lifestyle. Lack of physical activity also reduces the ability to control blood glucose levels, increasing the risk of developing diabetes and dermatological problems, including scalp itching. Stress. Prolonged stress can also affect blood glucose levels and overall health, contributing to scalp itching. Managing itchy scalp related to blood sugar. If you experience an itchy scalp along with other symptoms associated with diabetes, such as fatigue or frequent urination, it's crucial to have your blood sugar levels checked. Blood glucose and HbA1c tests, measuring average blood sugar over 3 months, will help your doctor assess your condition for diabetes or prediabetes. Dietary adjustments. Reduce your intake of sugary and starchy foods, and increase your consumption of fruits, vegetables, high-fiber foods, and protein. This not only helps manage blood sugar, but also improves scalp health. Increase physical activity. Engage in moderate exercise such as walking, yoga, or swimming to improve blood circulation and help your body utilize insulin more effectively, thereby reducing scalp itching caused by high blood sugar. Scalp care. Use a gentle shampoo specifically formulated for sensitive scalps to soothe and alleviate itching. Avoid harsh chemical products that may worsen the condition. Stress management. Stress can elevate blood sugar levels and negatively impact scalp health. Explore stress reduction techniques such as meditation, deep breathing exercises, or listening to relaxing music. Tests you can try. Scalp sensitivity test. Gently touch your scalp to check for any pain, itching, or burning sensations. This may indicate inflammation or damage to the scalp tissues due to blood sugar issues. Blood sugar level check. If scalp itching persists and you have symptoms related to diabetes, check your blood sugar levels to see if you are experiencing blood sugar problems. 5. Itching on the soles of the feet. Foot itching can be a symptom of nerve damage, a condition known as neuropathy. This occurs when nerves in the feet or other parts of the body are damaged, often due to poor circulation or diabetes. Damaged nerves send incorrect signals to the brain, resulting in itching, burning, or numbness. Another cause of foot itching is reduced blood flow, particularly in conditions like peripheral artery disease, PAD. Decreased blood flow deprives foot cells of essential nutrients and oxygen, leading to itching, burning, or pain. Diabetes can damage blood vessels and nerves, especially in the lower extremities. Poorly controlled blood sugar can cause diabetic neuropathy, damaging foot nerves and causing itching, pain, or numbness. Unstable blood sugar levels, especially in diabetics, can also lead to nerve damage. Prolonged high blood sugar causes inflammation and damage to small blood vessels, particularly in the extremities. This damage can result in itching, numbness, or burning sensations. Finally, foot itching can stem from infections or dermatitis. Wounds, fungal infections, or inflammation can cause itching and discomfort. Foot itching, signs and risks. Nighttime itching. Itching of the soles of the feet, particularly at night, may indicate circulatory or neurological issues. As the body relaxes and blood flow slows at night, itching symptoms can worsen, especially for those with diabetes or nerve problems. Numbness, tingling, or burning. Itching accompanied by numbness, tingling, or a burning sensation may signal nerve damage. Nerves may not be transmitting signals correctly to the brain, resulting in unusual sensations in the feet. Difficulty moving. Persistent itching combined with numbness or pain can lead to difficulty walking. This is particularly dangerous as it increases the risk of falls and accidents, especially for the elderly or those with neurological conditions. Skin discoloration. If itching is accompanied by changes in skin color, such as paleness or discoloration, it could indicate circulatory problems. Insufficient blood flow deprives cells of oxygen and nutrients, leading to changes in skin color. Risk factors for foot itching. Diabetes is a major risk factor for neuropathy and foot itching. Individuals with long-standing diabetes, particularly those with poorly controlled blood sugar, are more susceptible. Poor circulation. Those with circulatory problems, such as peripheral artery disease, may experience foot itching due to reduced blood flow to the lower extremities. This is especially common in older adults or those with sedentary lifestyles. Poor diet. An unhealthy diet lacking essential vitamins and minerals, particularly vitamin B12, can contribute to nerve damage, leading to itching and other neurological symptoms. Weight issues. Obesity can negatively impact circulation and nerve health, increasing the risk of foot itching. Excess weight can impair blood flow, especially to the lower limbs. Comprehensive health check intervention and solutions. Persistent itching on the soles of your feet, especially when accompanied by symptoms such as numbness, pain, or discoloration, warrants a doctor's visit for neurological and circulatory assessments. Blood tests can help identify potential issues like high blood sugar or cardiovascular disease. Dietary adjustments. Maintaining a healthy diet helps control blood sugar and improve circulation. Foods rich in fiber, vitamin B12, and omega-3 fatty acids support neurological and circulatory health. Limit foods high in sugar and unhealthy fats. Regular exercise. Physical activity improves blood flow, enhances circulation, and reduces the risk of neurological disorders. Exercises like walking, yoga, and swimming benefit cardiovascular health and may alleviate foot itching. Special foot care. If you experience foot itching, keep your feet clean and dry to prevent inflammation or infection. Use moisturizer to prevent dryness and avoid unwanted injuries. Regular diabetes checkups. For individuals at risk of diabetes, regular blood sugar monitoring and preventative measures are crucial to minimize the risk of nerve damage and other complications. Now you're more aware of the serious health issues that itching can sometimes indicate, especially as you approach your 60s. Early detection and treatment of these subtle signs can contribute to a healthier, longer life. Don't ignore seemingly harmless itching. It could be a warning sign. If you've experienced this or have any health questions, please feel free to comment below. Remember, proactive self-care contributes to a long and healthy life. Please like, subscribe, and share this video with loved ones to promote collective well-being. Thank you for watching, and we look forward to seeing you in our next video.